Pre-warning signs of stroke before it happens. Hello friends, today I am going to show you some pre-warning signs of stroke before it happens. By knowing this, you will be able to prevent yourself and your family from the stroke. Before learning, please subscribe my channel and hit the bell icon. What is stroke? A stroke occurs when an artery in and around the brain becomes blocked or ruptures due to a blood clot. These blockages can prevent the brain from getting the blood and oxygen it needs, causing brain cells to begin to die. If treated right away, your doctor can help reduce the long-term effects of the blockage. This means that stroke symptoms require urgent treatment. Here are some most common warning signs of stroke. Speech difficulty. One of the most obvious signs that someone has had a stroke is a change in speech. Their speech can be slurred and hard to understand. You may also notice that they have no control over their words when they try to speak. Their speech can even become rambling and meaningless. When you talk to them, they may seem confused and disoriented. It may be difficult for them to understand what you are saying. Muscle weakness. A person who has had a stroke may experience weakness on one side of the body. Sometimes the paralysis is obvious, such as the inability to move the legs or arms. In such cases, you may not be able to fully raise your arm or grasp an object with one hand. In other cases, muscle weakness may be more subtle. You may stumble when you walk, complain of numbness in your limbs, or have one side of your face droop. You are worried about a stroke, you can ask the patient to smile. One side of your smile is lower than the other, it may indicate a stroke. It's easy to ignore limb weakness after knee surgery, but notice if it's different than what Dr. George did. Noise tells him to wait until he recovers. Walking issues. Some people who have had a stroke are still able to communicate but have difficulty walking. You may lose your balance more easily than usual when standing or walking. You cannot see certain signs of walking problems, but people can complain about the weaknesses of a foot. It is possible to have weaknesses in their hands on the same side of the body. If this weakness comes on suddenly, rather than after intense exercise, you may want to check for other stroke symptoms or see your doctor. You may have difficulty walking after knee surgery, but this will improve over time. If your ability to walk gets worse rather than better, or if you find it difficult to walk in the months following surgery, it may be a good idea to discuss your situation with your knee surgeon. Difficulty seeing. Another warning sign of a stroke is vision problems and vision changes. A person may complain of double vision or blurred vision. You may lose sight in one or both eyes. It is normal for vision to change as people age. These changes usually occur gradually over months or years. Vision loss from a stroke can occur suddenly. Severe headache. Some strokes are accompanied by severe headaches. These headaches are usually more intense than other headaches and can resemble migraines. Headaches may be accompanied by vomiting and nausea. If you don't know what's causing your headache, such as dehydration or lack of sleep, or if it's worse than other headaches you've experienced, it's a good idea to tell your doctor. If you find any symptom, please go to your doctor because your life is more than anything.